Hello everybody, it's obstetric and gynecology made easy. Today we are gonna talk about pre-operative preparation before cesarean section. Before we start operation, there are 4 acts should be done. We can summarize guideline in the word act. These guidelines for patient investigation, medication and operation room. So guidelines for the patient include A. Avoid eating, C. For clipper for hair removal, T. Time of operation and too heavy patient. Guidelines for investigation include A. For anemia, C. For course matching, clotting screen and checking by ultrasound for placenta location and fetal presentation, T. For test for viruses. Guidelines for medication include A. Antibiotic, C. Corticosteroid, T. For thromboprophylaxis. Guidelines for operation room include A. For anesthesia and antiseptic, C. For catheter and crystalloid fluid, T. For temperature and tilt of the bed. Guideline for the patient. A. For avoid eating, fasting. The word eat starts with E letter and end with T letter. So we have 8 hours for food and 2 hours for liquid. 8 start with E letter, 2 start with T letter. C. For clipper or chemical depletion cream, not shaving, for hair removal. Hair removal prior to surgical incision, not pre-operative, associated with low surgical site infection rates. Time of operation. Plain cesarean section, not routinely done before 39 weeks. Too heavy patient with body mass index more than 50 kg per square meter alone is not an indication for plain cesarean section. Guideline for investigation. Anemia. CBC is done for all patients for hemoglobin or hematocrit. C. For cross-matching, clotting screen, checking by ultrasound for placenta location and fetal presentation prior surgery should not routinely done. Cross-matching and blood group done for patient at high risk of postpartum hemorrhage. T. Test for viruses, HPV, HCV and HIV if not done before. Rapid test for HIV. HPV transmission can be decreased if the baby receives immunoglobulin and vaccination. So, being the mother positive for HPV, HIV or HCV alone is not a reason to offer a cesarean section. Plain cesarean section offered for patients who are co-infected with HCV and HIV to decrease maternal to baby transmission of HCV and HIV. Plain cesarean section offered for patients with primary genital herpes occurring the 3rd trimester to decrease maternal to neonate transmission. Medication guideline. A. For antibiotic. 1 dose of cefazolin within 1 hour of incision. The dose is given according to the patient weight. If the weight below 120, we give 2 grams, and if the weight above 120, we give 3 grams. We add another dose in case of the blood loss more than 1,500 milligrams or the duration of operation is more than 4 hours. In case of allergy, we replace cefazolin with clindamycin 900 mg plus gentamicin 5 mg intravenous. And in case of history of MRSA, we add vancomycin, and in case of rupture of membrane or the case on labor, we add azithromycin 500 milligram intravenous. And post-operative in obese patient, we give cephalexin 500 milligram plus metronidazole oral 3 times a day for 48 hours. C4 corticosteroid. Corticosteroid is given for patients at risk of preterm. The administration dose starts from 24 week to 34 week and up to 36 weeks in special cases. Dexamethasone is given at dose of 6 mg every 20 hours for 4 doses. Alternative for dexamethasone is betamethasone 12 mg per 24 hours for 2 doses. The optimal benefits occur when delivery happens between 24 hours and 7 days after the completion of the course. T4 thromboprophylaxis. We have two groups, low risk group and high risk group. And this mnemonic to remember: thromboprophylaxis for low risk group, the letter of the word low. And for high risk group, we have 2H letter. For low risk group, L for lower limb pneumatic compression before caesarean section until the patient fully ambulatory. This is called mechanical thromboprophylaxis. And O for oral acetyl salicylic acid 8 hours post-operative. And W for walking, encourage the patient for early ambulation. For high risk, we have 2H letter. H for heparin and H for 100 kilogram, the weight of the patient. For high risk group, both mechanical and pharmacological thromboprophylaxis acquired. Pharmacological thromboprophylaxis start 6 to 12 hours post-operative until the patient fully ambulatory, approximately equal 10 days. And for patient with prior venous thromboembolism or high risk thrombophilia, prophylaxis extended up to 6 weeks. We have two regimens of heparin. We have low molecular weight heparin and unfractionated heparin. We adjust dose according to the weight of the patient, and as we said, we have two H for heparin and H for 100. We give low molecular weight if the weight of the patient below 100, we give 40 milligram once a day, and if the weight above 100 milligram, we give 60 milligram once a day. And if we give unfractionated heparin, we adjust the dose according to the weight also. And if the weight below 100 kilogram, we give 5,000 unit 2 times a day. And if the weight above 100, we give 5,000 unit 3 times a day. Guideline in the operation room. A for anesthesia. Spinal anesthesia is recommended than general anesthesia. And general anesthesia for emergency cesarean section, anticipated postpartum hemorrhage, failed spinal anesthesia, or if contraindicated to spinal anesthesia. Offer antacid like sodium citrate 30 ml immediate prior to anesthesia, H2 antagonist and proton pump inhibitor 40 to 60 minutes prior to induction. Offer antiemetic like metoclopramide 10 mg more than 30 minutes prior to induction. This promotes stomach empty and increase lower esophageal sphincter tone. A for antiseptic, antiseptic for skin and for vagina. For skin, chlorhexidine based preparation better than iodine based preparation due its efficacy to decrease surgical site infection rate. Use chlorhexidine alcohol preparation instead of povidone iodine. Allow alcohol-based skin preparation to dry completely before incision or use any electrical device. And for vagina, both aqueous chlorhexidine 4% and povidone iodine, especially in case with rupture of membrane to avoid endometritis. Alcohol preparation should be avoided because it irritates mucous membrane. Soak sponge, stick with solution, insert it and rotate in vagina, applying it for 30 seconds with 3 passes. Catheter, urinary catheter. Routine placement is not recommended. Patient with low complication asked to avoid before caesarean section. Crystalloid solution, glucose-free solution should be used to prevent neonatal hypoglycemia. Intravenous crystalloid colloding in addition to vasopressors to decrease the risk of hypotension occurring during caesarean section. Temperature of the room and fluid. Temperature of intravenous fluid and blood product should be at 37 degrees and consider 38-40 degrees for irrigation fluid. Tilt the bed left lateral up to 15 degrees or appropriate uterine displacement once the woman is in a supine position on the operating table to decrease maternal hypotension. I hope this helps. Please don't forget to like and share. This is the first part, to be continued for the second part.